Thank you very much. The next talk is by Dr. Andrea Vicari. He'll be speaking about HPV vaccine introduction in Latin America and the Caribbean. Thank you.
I will try to talk today afternoon about a little bit the context of new vaccine introduction in the Americas, especially a little bit on the financial sustainability of immunization programs, which is an important concept in introduction of new vaccine, as well finally a little bit on the equity of HPV vaccine introduction before going to some conclusions. I think I like always to talk, to start my talks with these slides, because I think it is always important when we are in this kind of symposium where we talk about only one vaccine, to understand that there are other new vaccines, and an important role of an immunization program is not to introduce only one vaccine, but to really create a background where we can introduce new vaccine, but as well prepare for the introduction of future new vaccine. And in that sense, I think it's very important to see as well HPV vaccine introduction. This is a graph of the introduction of the new vaccines in Latin America, of 3 new vaccines, PCV, pneumococcal conjugate vaccine, rotavirus vaccine, and HPV vaccines. These are, if you want, 2 vaccines that are really targeting childhood vaccines. They are really linked to one of the MDGs, Millennium Development Goals, and so there is really a good political will if you want to introduce this vaccine. On the other end, we have HPV vaccine that is not really directly linked to any Millennium Development Goal, and this could be as well a reason why you see a lower uptake. But another important point of this slide is actually that you see that the rotavirus vaccine in red here is actually started being introduced at the same time when it became available. This is the first vaccine really in history where it has been introduced in high-income country at the same time as it is introduced in a middle and low-income country. PCV, if you want, it started a little bit later, but in 2006, when it became available to United Nations agency, it really started picking up. So if you want, in terms of HPV vaccine, you can see it is a glass half full or half empty. I think, there is starting to having a movement towards the introduction of this vaccine. This is where we stand in the Americas. If you want, there are these 7 countries, Canada, United States, of course, that introduced the vaccine, but as well October of 2012, Mexico starting universal vaccination, Panama from October 2008, Colombia from August of 2012, Peru started in February of 2011, and Argentina as well in October of 2011. You can see as well that there are some French departments, United Kingdom territories, and Dutch municipalities that in principle should really offer the vaccine as well. But one important point, this is a table that you already saw this morning in another format, but I think the key issue here is that in Latin America and the Caribbean, HPV vaccine is still focused very much on females, and it is roughly given around age 9 and 10. There is no definitive strategy for this vaccination. Country will do, especially at the local level, they will use whatever strategy is necessary to get up to a good coverage. So I think the issue of whether one strategy is better than the other one is really to some extent a little bit academic. The other point here is really that defining what universal introduction is not so straightforward. I usually use this definition of being a vaccination that is fully or partially funded with public funds, that is really targeting the old cohort, and where there is really a structured program to try to achieve and maintain good coverages. One important key in terms of introducing new vaccine is really this idea of building a sustainable program. And one key to sustainability definitely is the financial sustainability. And so what you can see is the evolution of the immunization programs in Latin America, where with the introduction of new vaccines, there has really been an explosion of what the cost of the program is. But at the same time, what you can see is that the part of the national contribution to this funding is increasing as well. So basically, almost 100% of the program are currently based on national resources. And this is achieved through of enacting laws in support of immunization program. In general, what we call creating fiscal space for immunization programs. Of course, as well, it's very important what in terms of cost effectiveness analysis and other analysis that we can do in terms of creating the environment within a country where we can really create financial sustainability. So the PROVAC initiative at PAHO is really trying to develop tools for making evidence-based decisions regarding new vaccine. And the goal is really to strengthen technical capacity in country for evidence-based decision on new vaccine introduction. And often it is asked, why do we need to do more analysis, and why do we need analysis in each country? The truth is that country will expect to have own data and to have own analysis for decision making. And I think this is a very important step towards really empowering the country and really creating this financial sustainability, if you want. The SurveyVac model, which this is in a series of these models created by PROVAC, SurveyVac is really the model dealing with the cervical cancer. And you can see that the SurveyVac model really has two models, one on HPV vaccine specifically, and the other one on cervical cancer screening. I think what is important to highlight here is that we are really talking about analyses that are following in terms of HPV vaccination, a whole cohort from age 10 of when the vaccine introduced to the end of their life, and the same for screening, starting at 20 years of age to the end of their life. So in terms of compared to other model by PROVAC, the time horizon is much longer. And I think it is as well important that we have conceived this, and it is always for me important to explain that we are not really we don't want to contrast vaccination against cervical screening, cervical cancer screening. I think we are really talking about two different set of generation, if you want, two different set of women. And I think it will be not fair, to contrast the two. Although to an economist is what you will tend to do usually. Of course, vaccine price is a key issue as well in terms of achieving sustainability in the programs. And this is what was already shown this morning is the current price of the vaccine under what is the EPI revolving fund at PAHO. Is $14 low? Well, it's anybody's guess. I guess if you look at it from a lens of cost effectiveness, probably it's a fair price. But if you look in terms of the price paid in income country, it is a very low price. But maybe we should as well consider it from the cost production, what will be really the cost of production of this vaccine. And so there are many ways to look at this price. And I think, it seems that we are kind of getting to a bottom of what could be the price on the revolving fund, but there are many different ways we can look at this. The API revolving fund is really a strategic mechanism that consolidates basically the vaccine needs of PAHO member states and offer it to the providers via a formalized bidding process, and thus achieving economy of scale. But the price is not only one of the key fundamental issues of the revolving fund. In fact, the revolving fund wants to offer a planned supply of vaccine that is safe and of high quality. Oftentimes, it needs to be basically a WHO pre-qualified vaccine. It is a transparent bidding and purchasing process that essentially doesn't involve the national authority. There is this line of credit of 60 days that is achieved through the capitalization. Is a 3% that is added to the price of the vaccine to capitalize the fund. And of course, one of the key characteristics of the revolving fund is this idea of the lowest price available globally. And this lower price, it is important that we cannot, by revolving fund rules, we cannot really lobby for a lower price. It is simply an outcome of the bidding process. At the same time, it is a contractual clause in the yearly contract with the producer. That is that if we learn that the vaccine is available anywhere else in the world at a lower price, we can request that price. Of course, not everybody is a fan of the revolving fund. And you can see that sometimes, it has been said that the revolving fund is actually hampering the introduction of the vaccine, of new vaccine in other countries. And this, of course, has to do with what is called the tier pricing. No? The tier pricing is a well-established mechanism by the pharmaceutical industry in setting the pricing according to the country ability to pay. Those in light in the opinion of the vaccine manufacturing, increases the access to the vaccine. If you want, I always try to explain this idea a little bit different. If you want, the idea of tier pricing is come from this side. By income level, you would basically offer the vaccine at different price, at different tiers of price. The revolving fund of what we want to achieve with the revolving fund in the Americas is actually an issue of Pan-Americanism and equity. That is, if you calculate, basically, you take what could be an example of poverty and you multiply, you see that really it doesn't, the poor people exist everywhere. Independently of the level of income of the country. So from a regional perspective, it doesn't really matter whether you are living in a high income or middle income or low income country. And so the perspective is really a little bit different in the two senses. Of course, as well, if we consider only middle income, this slide is basically something that many of you understand, is the age standardized death rate. On the bottom is the country income. But the size of the bubble is essentially the number of deaths. So you can see what it means in terms of the America. If we cannot really achieve introduction of HPV vaccine in upper middle income country, we will really not achieve a significant reduction in mortality for cervical cancer. So it is key, if you want, that we can achieve a very low and sustainable price for HPV vaccine as well for upper middle income country. As you can see here as well, is the idea of that the vaccine is basically available as well with publicly funded HPV vaccination in all income countries of the region. Only half of the cohort in upper middle income is actually accessing the vaccine, and the vaccine is basically not yet available in lower and middle income countries. But what an important point here is definitely if you see that the typical girl cohort in this country, where the main number is really in the upper middle income countries. So again, an issue of being really able to offer this vaccine at the lowest cost for upper middle income country. Here it's an attempt to look at what will be the global market for this HPV vaccine. Basically, I'm taking just a typical cohort of adolescent girl, 1 year just. And you can see that basically there will be 58.6 million adolescent girls of one cohort in the world. Of these, just 7.6 million are in the Americas. When we take this 7.6, we can divide them into different type of countries. US and Canada, Puerto Rico, and French departments that are not acquiring HPV vaccine to the revolving fund and for which the revolving fund is not a reference price. Then you have Brazil and Mexico with 2.7 million girls. Brazil and Mexico do not purchase vaccine to the revolving fund, but for them, the price of the revolving fund can be of reference. Then we have 300,000 and 200,000 that are really countries that are either Gavi graduating country or Gavi eligible country. What is left, if you want, is these 2.2 million girls. Really a fraction, if you want, of the whole total. These are 24 middle-income countries that rely on their purchase on the revolving fund. And so if you want, this 2.2 million is really part of the 28.2% of the total potential market of America, and it's only the 3.7% of the potential global market. But it's a key because really to this revolving fund, to this 2.2, and the price that you can set for this really depend as well, if you want, a reference price for the rest of the world as well. So if you want this 2.2 million as really into this 7.9%, but you can certainly see what it implies in terms of other middle-income countries, whether in the upper middle or in the lower middle-income country. So in conclusion, I think I've shown that the new vaccines are being introduced in Latin America and the Caribbean. HPV vaccine maybe is introduced to a lower rate, and there are some reasons. The capacity to introduce new vaccine based on national resources, I think it's key to the sustainability. There is different layer to that, definitely creating fiscal space, having economic analysis, having a low cost of the vaccine, and definitely the role of PAHO revolving fund in setting a reference vaccine price for middle-income country in Latin America and as well possibly in the rest of the world. And this is, to date, it's probably one of the only opportunity we have really to offer a vaccine at affordable price for middle-income country worldwide. Thank you very much.